evening and a happy Madaraka Day from wherever you're watching us. My name is Michelle Ngele Odhiambo. On Front Row tonight, we focus on children and COVID-19. Are children a neglected population? COVID-19 cases continue to surge in different parts of the country, but what is the government doing to ensure the safety of children in the early years? Is there more that can be done? We'll be dissecting findings of a recent study by African Child Network, which reveals key risks facing children in marginalized communities, as well as proposed solutions and models and case studies for addressing existing barriers facing the childcare sectors in Kenya. We also speak about the situation globally and the situation in neighboring Ethiopia. We'd love to hear your thoughts on this conversation tonight. Do text us on 2215 and tweet us on KTN News Kenya and at Michelle Ngele. Helping us dissect these issues tonight are Peter Ombasa, who is the Assistant Director of Children's Services at the State Department of Social Protection. He is a social protection officer with 17 years of experience in the service. We'll also be speaking to Gladys Mugambi. She is a certified nutritionist and the national coordinator of the micronutrient program of Kenya. She has worked as a district nutritionist with the Ministry of Health at the Thika District Hospital for 10 years now, where she initiated a supplementation through early childhood development centers and developed a proposal for the funding of the National Food Fortification Program, among other roles. We'll also be speaking tonight to Dr. George Owen. I beg your pardon. Yes, Dr. George Owen, who was a PhD from the School of Public Health at the University of Bielefeld, Germany. He is currently the research lead at Africa Early Childhood Network. In this role, he coordinates all studies as well as those formulated collaboratively with partners. It is the conversation we'll have tonight. But let's begin this conversation by listening to some of the highlighted needs of children during the COVID-19 pandemic.
There were rules and regulations which were implemented by the national and the local government, so we were not involved as children and youth to give our views on what we want, on how the COVID-19 regulations and rules should be.
I realized that children and parents and all people who were affected, who did not have money to buy foodstuffs, this kind of young people brought up an idea to give them seeds to plant.
Nimejifunza juzi tulienda field tukaona kuna sehemu inaitwa Kiambu, kulikuwa kuna watu watoto wenyewe kwa wenyewe walikuwa wanajaribu kuchangiana ili waweze kupata sanitary pads. Kwa hiyo ni kitu nzuri ambao nimeona kwamba children wanakuwa na umoja, ambao pia naweza kwenda kuapply kwa nchi yangu kwamba tukawa na umoja, sio tuchukulie umaskini ni tatizo, tunaweza pia tukawa tunasaidiana sisi wenyewe kwa wenyewe kwa sababu tumetoka katika familia tofauti.
Let's begin this conversation tonight with Gladys Mugambi. She is the head of the Department of Health Promotion at the Ministry of Health. Thank you for joining us on Front Row tonight. A very important conversation we are having about children. Talk to us about the health needs of the youngest of children during the COVID-19 pandemic. What major issues have come up for children in this period?
Thank you, Michelle. And thank you for bringing this topic because our children are really important and we need to bring them up well. So in the health sector, we are very much committed to ensure that communities are well sensitized so that they take care of the children's needs, especially the health needs, which include taking their children for immunization, ensuring that their children are feeding well, and ensuring that the mothers who are breastfeeding are also well taken care of so that they can take care of the babies. Then there is also need to ensure that the continuity of services is going on at the health facilities so that if parents take their children, they are able to get the service as expected.
Right, and even as we speak about this, talk to us about the health policies that have been put in place or that are already in place that can then support early years or children in early years?
I'll start with the health policy, which has outlined all the things that need to be done in terms of maternal nutrition, the services being offered at the facilities, all the preventive measures. And in that health policy, we have the act that promotes breastfeeding at the workplace. So that is one of the policies. And then we have the food security and nutrition policy, which also stipulates what we need to do in terms of nutrition. We also have other policies that take care of the reproductive health issues, because they also have a link to the health of the children. And we work across sectors to ensure that we create awareness and we create an environment for children to be well taken care of.
All right. Well, let's bring in Mr. Peter Mombasa. He is Assistant Director of Children's Services at the State Department of Social Protection. Since the advent of COVID-19, since COVID-19 was first reported in Kenya, we have had reports from UNICEF, for example, stating that measures to curb COVID-19 have resulted in an increase in domestic violence and gender-based violence as well. Many children, especially the youngest, have been caught up in this. Speak to us about how such adversity at an early age, child abuse, witnessing domestic violence can impact children, especially in their earlier years.
Thank you so much, Michelle, and thank you for welcoming me at the front row. I want to categorically say that the Children's Service really works extremely hard to make sure that all the children are safe wherever they are. I want to, first of all, say that the topic you say that whether they are neglected lots, it's not true. For sure, children are not neglected at all. They are basically one of our constituents that we talk about. Having said that, I want to talk about the two particular things that you've basically mentioned, of course, child abuse and, of course, domestic violence. I basically want to look at the Children Act, which is a guiding principle for this matter, and under definition says that, of course, child abuse is purely physical abuse, sexual abuse, and, of course, psychological, emotional, and, of course, mental injury. And, of course, what is domestic violence? Domestic violence is any abuse that is done at the home, whether the people are married or not married, but basically it's done at the home. Mm-hmm. Then what is the effect it has to purely the children? Quite a raft of problems that they bring, especially when we have domestic violence. For instance, studies show that currently the domestic violence has gone up due to COVID, and this makes the child vulnerable, and more so making sure that the child basically does not have the right parental guidance for that matter. And of course, under abuse, once the parental guidance is not there in place, chances are high that the children will basically move out. Once they move out, they'll look for other ways of enhancing play, and of course, in that way, they enter into bad company. Mm-hmm. And I think those are some of the things that I wanted to bring up in this discussion so that we can have more discussions. Thank you.
All right. And of course, speaking of early years, we're talking of contexts such as early childhood development, childcare facilities, which are the very basic, very important in informal settlements where many parents have to work longer hours. Talk to us about the social protection policies and interventions that have been put in place in terms of nutrition and childcare facilities at the very basic level.
Thank you so much, Michelle. I want to base my discussion here on the Children Act still. Under Chapter 5, I want to talk about, of course, sections number 48 up to 71. They talk about charitable children institutions, whereby that particular philosophy of childcare comes in between. I will want also to respond to your question into two ways. Number one, what are the charitable children institutions that are regularized by the government? And number two, what are the child care institutions that you clearly talking about? The CCIs, which are commonly known as charitable children's institutions, are basically regulated by the Department of Children's Services. And these CCIs are basically those homes that you call children homes that the government is aware they are providing care and protection for the children. However, the other part that we need to discuss more is about the child care. By and large, call it daycare, because that is the best terminology that we can give it. Under daycare, what do we mean? This is when children are left to somebody to take care of that child within the day, so that in the evening, the parent can come and pick the child. The question here that we ask, is it regulated or not? And this is one of the things that we need to talk about. The 2010 Constitution clearly devolved this particular function to the county government. So daycare centers are basically a county government function. But by and large, the child is a person below the age of 18. In any matter that we are basically brought into perspective, and we are told that there is danger of a child in a daycare, the Children's Service will basically enter any time and, of course, give instruction and direction as to how the child will be handled.
Absolutely, and we will discuss this a bit more because it has become booming business really to have a daycare. Just bring in Dr. George Owen. He is a research lead at Africa Early Childhood Network, and really get a perspective of what people on the ground have to say. Findings of a recent study by African Early Childhood Network reveal several risks facing children, especially in marginalized areas during this COVID-19 period. Talk to us about some of these risks and findings.
Thank you very much, Michelle. As indeed, as you've said, children in marginalized communities face a number of risks. Actually, we interviewed mothers, we interviewed community leaders like the chief, we interviewed community health workers to just find out their perspectives on what are the risks that children face in this kind of circumstances. And it was by consensus. Some of the things they mentioned include lack of a clean and safe playing environment where children can play. One of the key pillars of early childhood development is the opportunity for children to play. And if children lack places where they can play, then they miss a very important ingredient in early childhood development. Another risk that we can relate directly to the COVID situation is the situation whereby many parents, many mothers have lost jobs, they don't have incomes, and so without income, it means that the basic services that they provide for their children, for example, nutrition, children don't have adequate nutrition. Another key pillar revealed by science about how children can develop properly is nutrition, which provides the foundation for later development. These are compromised in the context of COVID. We found out really that children are lacking good nutrition. Another thing we found out there is the issue of lack of safe and clean drinking water in this kind of communities. We're talking about urban informal settlements. We're talking about settlements that are associated with the flower farms in Naivasha, where we did the study. We are also talking about Ethiopia as well, in areas where they also grow flowers, areas of prisons as well. And talking about prisons in Kenya, for instance, you find that of our 43 female penal institutions in the country, only 10 have got fully functional daycare centers. That means in 75% of the prisons, there are no facilities to provide for children. So these are kind of the things that we're talking about. This is the situation that children face. If you talk about COVID and there's no place for play, no space, you're talking about infections, you're talking about lack of how to control the issue of avoiding infection among children. The same study also seems to reveal the importance of childcare services as well at the very basic level. Many caregivers, feeling that childcare services prepare children better for the future. Many have no option really than to leave their children at childcare services. What from this study has been the assessment and the gaps involved in childcare services in society? Again, thank you very much. When we did our study, we wanted to find out the best place to take care of children during the day when mothers and fathers have gone to work, some leave even as early as 5 a.m. to go to work, and they need a place where they can drop their children as they go to work. What you find is that during the COVID situation, schools were closed. Daycare centers, the formal ones, were also closed. So the option that the parents had were informal ones. And so they had to go to people who have opened a place in their homes, in single rooms, to provide for these children. When we assessed these facilities, you realize that in the ways of assessing quality, we have a scale that is known as infant toddler rating scale that assesses childcare in 7 domains on a scale of 1 to 7. For example, interaction between the caregiver and the children. You're talking about parent-caregiver interaction. We found that of all these 7 domains, out of a scale of 7, the facilities, none of them had more than 2 out of 7. We are talking about very low levels of quality in these informal daycare centers. But these are realities that are going to live with us. We can't wish them away. When formal institutions were closed, this came in very handy to support the parents. So I think what really is there, what also we found in Ethiopia, there were no daycare centers. In Kenya, at least, there were those informal ones that supported the parents. And we realize in these facilities, a daycare giver has got about 5 to 10 children that she's taking care of. She's one person. And one of the pillars of early child development is this nurturing, responsive, stimulating care. A lady has got about 7 children to take care of. Maybe each of them has a need, and their needs to be addressed immediately when they cry, when they ask for kind of support. When it's only one person taking care of them, she's not able to really meet all their needs, and therefore the environment for nurturing care is lacking in this kind of situation, and therefore the children are missing a very key ingredient in their development: responsive, stimulating childcare.
Right. And let's bring in Gladys Mugambe. She is joining us by way of Zoom. Even as we speak about this, let's speak about the impact of COVID-19 on maternal nutrition and really the impact or the quality of a baby's life within the first 1,000 days of life. Because with COVID-19 came the healthcare system being overwhelmed, with misinformation that came with it. Many were afraid to go to hospital for routine checkups for fear of contracting COVID-19. So a huge population, especially of pregnant women and, children that had been born in that period, have not got the right healthcare that they should have received. What impact has this had on maternal nutrition?
We've noted that parents have reduced in terms of taking their children to the clinic. And it's expected that they should go to the clinic every month to make sure the children are checked. But most of them don't go, and it could be that they have fear of going to the facility. So what we could recommend is that we continue providing the services closer to them, that is at the community, because we must continuously take care of these children. The other thing is that this COVID could affect the way our children are taken care of, given that most people have had economic challenges, and they are likely not to give their children a well-balanced diet, meaning that they should give a variety of foods and doing it in the appropriate manner. So we want to ensure that this continues, and it requires that we have an approach whereby all stakeholders are involved and we are able to support these families so that they continue feeding their children well and their mothers. This is likely to be more of a problem in areas that are far from the facilities, as the study that has been shared shows. And this means that we need to continue creating awareness and making sure the services are going closer and telling people to go to the facility. We're also using the community health volunteers to ensure that we continue passing information to the families and the households. Yes.
All right, let's take a short break here on Front Row, a conversation on children and COVID-19. Are we doing enough? Has society done enough? Has the government done enough to protect children from the impact and the effects of COVID-19? When we come back from this short break, we'll also be talking about context of restricted facilities, informal settlements, and children growing up in prison facilities and prison environments as well. Are these environments safe for young children, especially in this time of COVID-19? Do speak to us on this conversation, 2215, or tweet us at KTN News Kenya or at Michelle Ngele. This is Front Row.